for your presentation. Now I would like to invite Dr. Michelle Hampton from the School of Nursing.
Good morning, everyone. I'm going to talk about a project we're working on in the School of Nursing. The Institute of Medicine's 2003 report, Unequal Treatment, compiled multiple studies that documented health disparities between Black and Indigenous people of color and white patients in the U.S. And it crossed every education and income level and every specialty service from cardiovascular care to cancer treatment, HIV/AIDS, and mental health. They concluded that disparities did not stem from personal preferences or appropriate treatment decisions given a patient's condition, but rather they result from discrimination and bias within the healthcare systems and from individual healthcare providers. And with 3.8 million nurses in the US, which make up the largest group of the healthcare profession, and for context, that's 3 times the number of physicians, only 6% of that group are Black registered nurses compared to 13.4% of Black people in the general population. And since Black healthcare providers are more likely to live and work in their own underserved communities, it makes sense that the Institute of Medicine followed the Unequal Treatment Report with the Future of Nursing report in 2011 that proposed that health disparities might be addressed by increasing the number of nurses from underrepresented groups. Next slide, please. A 2014 nursing workforce study looked at the representation of Black nurses in every state compared to their representation in the general population, and they found that on average there was a gap of 13.6%, with a low of 0.6 and a high of 25.6%. But the trend that was most pronounced was the region of the country with the most consistently large gaps were located in the southern states. Both the overall discrepancy and the likelihood of a wider gap in the southern states indicates that the issue can't be dismissed as anything related to a single student's academic performance, and it's more likely that a systemic barrier or a series of barriers exist that exclude qualified Black persons from entering the nursing profession. Next slide, please. One of the primary gatekeeping points of entry to nursing in is higher education admissions. Students can enter RN programs at community college associate degree programs or 4-year university bachelor's programs. And in both, there are many more applicants than can be admitted. And studies show that only a few things predict academic success in a nursing program, and that's science GPA, repeating science courses, a certain nursing entrance test called the TEAS, and family income. And the majority of schools have admission criteria that aren't evidence-based. On the left is the typical 2-step admission process that includes overall GPA and standardized tests like ACT or SAT. And they require students to go through 2 separate, potentially biased admission cycles. There's also the issue of achievement gaps that are the cumulative result of attending underfunded and segregated schools, teaching by educators that perceive them as less capable than white students, grade them more harshly, and discipline them unfairly, including school suspension starting as early as preschool. Also, many schools add additional criteria that further disadvantage students of color, such as requiring certified nursing assistant certificates. That's an additional $1,500 to $2,000 expense. And though some schools have made standardized tests optional for general admissions, nursing programs still require them. And then other schools give weight to students who take prerequisite courses at the university, so the likelihood of community college transfer is slim to none. So the Association of American Medical Colleges suggested that admissions selection committees implement holistic admissions processes that value the inclusion of race and ethnicity as a consideration when it meets the goals of the university's mission. Boston University School of Medicine did this, and they were able to increase the number of students from underrepresented groups from 12 to 20%, and did this without seeing a drop in overall GPA and MCAT scores. Next slide, please. The purpose of our study is to examine the admission criteria in all accredited bachelor's and associate degree programs in the U.S. to determine if the charge of the Future of Nursing report in 2011 was acted upon in terms of admissions processes. We're collecting data on individual criteria, types of programs available in different geographic regions, and affordability of the options. Next slide, please. We have a need for Black nurses in hospitals, community settings, but also in faculty positions. And for all of those, it starts with clearing this first hurdle of nursing program admission. This work is a way to raise awareness of the bias in nursing admissions because the effects of privilege are cumulative, as are the effects of the lack of it, and processes that are blind to that disadvantage many people of color, but particularly Black students who are heavily impacted by deficit thinking in teachers at every level of the education system. And resolving this issue is not just an issue of fairness. Health disparities result in more than just annoyance. They lead to premature mortality, disability, and financial ruin for people who are uninsured or underinsured. And having representation in our profession is a first step to making a dent in that problem. I just wanted to finish with one thought. I watched an episode of John Oliver on Sunday night where he talked about bias in jury selection. And he mentioned a study that showed that all white juries were significantly more likely to prosecute Black defendants over white ones. And when one Black person was on the jury, this made a difference. And this is why representation is so important and has the ability to improve our healthcare system. Thanks.